Man or woman, we always say the hair follicle is a very emotional organ. If you're having hair loss, a bad hair day can turn into a bad hair week, a bad hair month, a bad hair life. Hair is just one of those things that it often defines us.
We're excited to have Dr. Alan J. Bauman, a leading expert in hair restoration and the founder of Bauman Medical Group.
With over 2 decades of experience, he helps men and women regain their confidence through innovative treatments. Let's dive in.
So, Doc, what is hair?
Hair itself is keratinized protein. You need to have protein to build hair.
Is hair actually alive?
Hair is dead tissue.
So how big is the hair restoration business?
20% of men in their 20s, 30% of men in their 30s, 40% of men in their 40s have visible signs of hair loss. So the potential for treatment is out there. When you restore someone's hair, it makes a huge change in their self-confidence and their self-esteem. Time equals follicles. The longer you wait, the worse the hair loss is going to be.
Why are people losing their hair?
The main reason for male and female pattern hair loss is
Welcome to another episode of A Healthy Point of View podcast. I'm your host, Sam Tejada, and today we have a special guest. This guy here is the GOAT when it comes to hair restoration. You've probably seen him on CBS, CNN, Fox News, all over the place. He speaks internationally. He is the guy. He's not just the expert, he creates experts. We have Dr. Alan Bauman. How are you, Doc?
I'm doing great, Sam. Great to be here with you.
Absolutely, man. I'm excited about this. You know, I've been hearing about you since I got into the industry of functional medicine. Because, you know, a lot of the guys that participate in these concierge medical therapies, a lot of them end up losing their hair and they want to find the best of the best. So you start hearing about this doctor, Alan Bauman, you know, who's all over the news. Everyone's talking about him. So I'm excited to have you here and talk about hair restoration because this is something that people deal with. Based off of medical conditions they have, hormonal imbalances that they might have, all kinds of different issues that I want to pick your brain about. And a lot of our listeners, we have a lot of doctors, over 4,000 doctors that tune in to the podcast. You know, obviously they purchase a lot of the Liquivita products for their practice. And you know, I think a lot of them are always venturing into what else can they do for their patients, right? And when it comes to hair restoration, it's more than just hair transplant. There's a lot of things that go alongside with that. So
absolutely.
Let's dive deep, man. How did you even get into the whole hair restoration? Was that something that you just wanted to do since a young age?
Well, actually, no, it didn't happen that way. I didn't really know much about hair transplantation growing up, although I was interested in cosmetic surgery really before I could drive a car. And I happen to have been mentored by a very prominent plastic surgeon in New York City around that time. And he kind of led me towards the more artistic side of surgery, which was plastic and reconstructive work, essentially. But it really wasn't until much, much later on, obviously, through medical school, internship, and residency, did I actually meet a hair transplant recipient and then come to understand just how natural and beautiful it could be. And then I remember that conversation with him, how it changed his life, both socially and professionally. And I was already into these cosmetic treatments and procedures, you know, through, you know, many years of training, but I didn't really know much about hair transplants. And when I met that patient and his hairline looked amazing and undetectably beautiful, I had to find out more about the technology, more about the field. And that was back in the mid-1990s. Where most things in terms of hair transplant were pretty pluggy looking, like why would you ever want that or do that? And his hairline looked amazing. So I basically interrogated that patient to find out what happened, how did he get it done, who did he go to, and I had a whole conversation. And that was really the fork in the road that changed my changed the direction of my career and my whole life, actually.
Wow, that's back in the 90s. So when did the hair transplant really start? Was it in the 90s?
So if you look back at old Japanese writings, even in the 1940s, there was a Japanese surgeon who was doing eyebrow transplants with single follicle implantation. Now, of course, much of that was lost in the war and lost to translation, but really it was Dr. Ohrenreich back in the 1950s and 60s here in the U.S. who was doing plug-type transplants, literally using a dermatologic 4-millimeter punch to move hair from the balding area, or from the non-balding area to the balding zone. And actually, he tried to publish that information in all of the derm journals and got rejected like 6 or 8 times.
Oh, really?
And it wasn't until after years and years of trying and proving that it could actually work, did they actually believe him that that hair transplant
Wow.
could actually actually do what it needed to do, which is to grow hair in a bald zone. But fast forward many years later, you've got strip harvesting, strip surgery, and then eventually microscopic dissection of the grafts, and then follicular unit extraction. So fast forward to today, we don't have to cut a big strip out of your scalp. This is no linear excision anymore. We can literally
Right.
take the individual grafts as small as a single hair follicle, one at a time, from the back of the scalp,
Wow.
leaving no linear scar. And so
It,
that's
it,
the technology that I'm excited about. That's the technology. I didn't
yeah.
invent it, but I helped pioneer it.
Right. Right. And let's talk about that because I remember growing up, guys would go and get hair transplant surgery, and they had this like crazy big scar in the back of their head. And a lot of these guys, they ended up losing the hair plugs that they got from back then, and now they're just straight up bald with a bunch of scars on the back of the head. Now, fast forward to today, the technology is just completely different, right?
Totally different. So, look, all of us who were trained around that time in the 1990s and early 2000s, we all underwent training with the linear harvest. So that was
Right.
called FUT, follicular unit transplantation. You would take a big strip of skin containing the follicles, and it was microscopically dissected into grafts, and then those were implanted.
Wow, what a process.
Labor intensive for sure, but certainly left you with a long linear scar in the back. And so those folks who kind of gave up on the process, maybe they didn't do medical therapies, maybe they didn't have enough hair transplants or have enough hair transplantable hair. Honestly, they're left with that long linear scar and they kind of gave up, and that's what you see.
Right. Right.
The good news, by the way, we can fix that. If you know somebody with an old scar, there's lots of ways to camouflage it, to put hair back into the scar, to remove the scar, to
Oh,
camouflage the
nice.
scar. So, you shouldn't lose hope if that's what you're left with.
Right. Right.
But today, someone starting out with hair loss can feel comfortable that they will never, ever have a linear scar to deal with if they do follicular unit extraction, FUE procedure.
That's good to know. So, talking about someone not having to worry. There is a very strong component with people losing their hair, how that affects them, that affects their self-esteem, affects their emotions. Now, as a medical doctor, as a surgeon, sometimes people don't understand that there's almost like a therapist role that you play in this process as well too, because you're really giving people their life back, right? You're giving them their mojo back, their self-esteem, and you probably see people their whole personality, their whole persona changes completely. So I want to dive a little bit deeper into that because there's a mental health component that's involved with getting the hair restoration procedures done. What have you seen?
So, man or woman, we always say the hair follicle is a very emotional organ. And so, obviously, if you're having a good hair day, that could color your whole afternoon, so to speak. If you're having a bad hair day, whoa, stay away,
Yeah.
right? And so, if you're having hair loss, a bad hair day can turn into a bad hair week, a bad hair month, a bad hair life. Not so good.
Right.
And just like that first patient that I met who told me about how his professional life changed, his social life changed, why did that occur? Well, it became evident to me through that brief conversation that it was a change in his confidence, his
Right.
self-image, his self-esteem. And hair is just one of those things that it often defines us, whether you decide to shave it or dye it or color it or wear some kind of hair wig or whatever you decide to do, hair is a part of our personality. It's a sign of self-expression.
It is. It
And
is.
so I think as just part of the human experience, when we groom ourselves, hair is a part of it.
Yeah.
No
I
matter
mean,
how
you're
you
talking
wear
to
it.
me, man. I get a haircut twice a week.
Ah,
So
okay,
that's
so
how I
you
am.
know.
I like to have a fresh cut, and I enjoy my hair. Even like growing up in high school and stuff, I was like had curly hair, and like it's just like part of my persona. So I can only
Absolutely.
imagine if I start losing my hair, I lose that. So you're changing lives, not just men but women too.
Absolutely.
Backstage we were just talking about how you could do procedures where you don't actually have to take actually have to shave the back of the head on women. You can actually take the hair follicles out while the hair is long.
Correct. So there's some newer technologies available now due to some of the instrumentation changes and our techniques that we've perfected, where we can literally take those transplantable grafts, remember the grafts contain the follicles, without trimming any hair.
Right.
And so you can undergo a procedure and no one would be able to tell, obviously, immediately after that you've had any kind of change to your hairstyle whatsoever.
That's amazing.
And that's important for women who are undergoing hair transplantation for sure.
Yeah.
And this technique also allows us to do eyebrows and eyelashes and things like that at
So
the same time. But yeah, when you restore someone's hair, it makes a huge change
yeah.
in their self-confidence and their self-esteem. And that could mean job openings. It could mean you're doing better on an interview, whether you're on Zoom or in person. It may mean more confidence in talking to someone about a relationship, for example. And this gentleman, that first patient that I ever met, his life completely changed.
Yeah.
My dad was the same. My dad struggled with hair loss for most of his life. He was totally bald and wearing a hairpiece when I went through medical school, internship, residency training, and I had the opportunity to transplant his head of hair back.
Oh, nice.
And putting back, it was a heroic effort. Over 8,000, 9,000 grafts for my dad really changed his entire outlook.
That's
Not having to
amazing.
deal with a hairpiece, but having a full, thick head of his own, healthy, living and growing hair.
So you as a physician, would you say that that's probably one of the most rewarding parts of your job is actually seeing people get their self-esteem back?
Oh yeah, the results are that's the payoff, right?
Yeah.
So we have patients come back at 6 months, which is about halfway through the growth phase, and of course at 9 months and then 12 months to see the final result. And we want to photo document that. We want to show the before and the afters. And when those patients see their before and the afters, they realize how far they've come, and then they start telling me about how people are noticing that they look different, and also how they're acting different.
Yeah.
I mean, that's a big payoff for
I
me,
agree.
for
amazing.
sure. I mean, it's a
love
lot
that.
of fun. It's, it's not instant gratification because hair does take a while,
Right.
to grow,
But it
so
comes,
to speak.
it
But
comes.
just stay patient. That year's going to go by, but, and then you have it forever.
I love that. Doc, so how big is the hair restoration business?
Wow. Well, hair loss is a huge problem, right? In America, there's over 100 million Americans with hair loss, and that would include men and women.
Wow.
So let's say maybe about 80 million men, about, maybe 30 million women, 40 million women. So there's a lot of people out there dealing with it. 20% of men in their 20s, 30% of men in their 30s, 40% of men in their 40s have visible signs of hair loss. So the potential for treatment is out there. You may have heard about this new trend, medical tourism. People are flying to distant countries for what I would consider low-budget hair transplants out there. And certainly there may be some good surgeons out there, but a lot of times they're running into trouble and they're getting taken advantage of on social media, Instagram and TikTok and whatnot. And they're being lured to these, unregulated locations.
And
to have
this
hair
is actually something
transplants.
that I wanted to dig a little bit deeper on.
Yeah.
And it's part of the things that I want to talk about on the podcast. And now that you brought it up, is I've seen a lot of that. People going to Turkey specifically. And there's even on social media, people show like the airplanes coming back from Turkey and everyone's got their head wrapped up.
Yeah.
So, there is a positive side to medical tourism, right?
Mm-hmm.
But at the same time, sometimes I question how cheap this is being done. And then also, are they utilizing the most advanced technology? Are they cutting corners? Like, how safe really is it for people here in the United States to save a couple bucks, go all the way to Turkey and get this done? Because at the end of the day, you start having complications and you're back here in the U.S., now someone else has to pick up a different doctor's slack. Like, what have you seen with this medical tourism stuff?
Yeah, so the industry has seen some pretty bad nightmares coming back from all areas of medical tourism, and it's very well known that Turkey is a destination for hair transplants. Also, turkey teeth is a thing, and 6 people died last year from turkey teeth.
So like people
Google
getting
that.
their teeth done?
Yeah, dental
Whoa,
restoration.
really?
So look, there's a real lack of regulation. There's maybe there are clinics there that are not run by physicians, that are just run by folks that are not medically trained. And so what kind of sterilization protocols are they using?
Right.
What kind of instrumentation are they using? There's certainly a big lack of artistry. You've seen the videos. People are coming back with a straight line hairline that just does not look
It's not
normal
like a
and
natural,
natural.
right,
Yeah. And
right.
so, I mean, there's only a certain percentage of people, a small percentage where that might look good. The rest, not so good.
Right.
And so medically, like we know here in South Florida, people have traveled to Costa Rica and Mexico for cut rate liposuction and BBLs or whatever it may be in cosmetic surgery. And they come back with infections, with problems, with scar tissue. And those can be very, very difficult to treat, from a cosmetic surgery standpoint. And very often those folks come back, they're literally walking wounded.
Right.
And I would say the same is true about medical tourism in any cosmetic type of procedure.
So
But yeah,
what's your
something's got to give. You can't
Yeah.
do what we do at that level, that's safe, effective, and artistic, at a cut rate shop.
So people that are listening now, if they were considering potentially going overseas to get, hair transplant done, what's your recommendation on it?
My recommendation is to do your homework. Be very, very clear who the surgeon is. Can you speak the language? And also, just do you want to be in a low oxygen environment immediately after your procedure?
Right.
I mean, that's probably the worst place to be with you've had skin surgery.
Right.
And that's what's happening in an airplane. You fly there, fly back the next day. You're first of all, you're bleeding through your bandages on the plane. For many airlines,
That's
that's
gotta
like
be
a no-go.
uncomfortable.
Yeah, you can't even get on the plane with bleeding bandages anymore, which is the reason why you see those folks on TikTok. They're just bleeding all over the place with no bandages.
Jesus, that's crazy.
Yeah, and there was someone just recently arrested in Miami, bleeding through his bandages. They tried to get him off the plane. He resisted. He was arrested. Pretty
Oh,
bad
wow.
situation that
Wow.
made news around the world. So I would just say do your homework. Find a board-certified hair restoration physician, American Board of Hair Restoration Surgeons. There's about 200 of us worldwide. Find a fellow of the International Society of Hair Restoration Surgery. That's the ISHRS, and there's a certain number of them. Do your research on the top clinics in the world.
Right.
Who are the top surgeons in the world today? You can ask Google that,
Yeah.
and you'll find a list.
Yeah.
But look for credentials, look for experience, look for expertise. If you're chatting with somebody on, Instagram Messenger or whatever, that's probably not a good way to get a detailed evaluation of
That's
your
not
hair
a
loss.
consultation that you should be getting for your hair loss, right?
Yeah, I mean, no
I've
matter
heard of
what.
telemedicine, but not what is it? Instagram medicine?
Yeah, Insta medicine. That's not going to
Insta-medicine.
work. We just coined the term. That's not a good plan.
Right.
Because also keep in mind that hair loss is a chronic and progressive condition.
Right.
Now, the transplants taken from the right area are going to be permanent. They're going to be immune to male pattern baldness, for example. But your other hair is not. Your other hair is at risk.
Right.
And so if you don't have a long-term plan, your short-term plan is to get on an airplane, get a hair transplant, that's not a good long-term plan.
Yeah.
And you're going to end up depleted of donor area, not on the right therapeutic regimen to protect the existing hair. You need a professional evaluation.
Right.
And, cloud pharmacies can also, run you into trouble as well.
Well, it's good that you bring this up because hair transplant is only one step of the process, right? So,
And should be
given
the last step, actually.
last step. It should be the last solution, right?
Right.
It's like I was talking about my back. Like I don't want to go on the knife. I want to make sure I do everything possible to make sure that I'm not dealing with the sciatica pain. So, but part of it is really kind of figuring out what the root cause is. If you're just like randomly starting to lose hair, right? There's a lot of issues of why you're losing hair. So that kind of leads me to the next question: is why are people losing their hair?
Yeah, so the main reason for male and female pattern hair loss is genetic. And so we are pre-programmed in some way to lose our hair, depending on our genetics. And so
Okay.
it does run in the family. It's not just the mom's side, and it can be both. It can be the mom's side and the dad's side that you're going to inherit the tendency to go bald.
Okay.
And so for male pattern hair loss, we know specifically what the trigger is. We know it's DHT, dihydrotestosterone, which comes from testosterone, and the follicles are sensitive to it. How do we know that that's the main trigger? Maybe not the only one, but a main trigger. Well, if we lower DHT or inhibit DHT production in the body, we can protect your hair, like pretty good, like 90% chance you're going to be the same or better in the long run.
There's medications that do that, correct?
Correct. So there's medications like finasteride and dutasteride, which inhibit the production of DHT, and they are powerful against the progression of male pattern hair loss. And you don't have to take it orally now. You can do it topically. There's also mesotherapy, dutasteride. You can also use herbal or non-medical ways to reduce the impact of DHT, things like saw palmetto. And there's many other ways also to protect and enhance the existing hair. But just to move beyond that genetic sensitivity, right, which miniaturizes the hair in the common way that you could see, hairline starts to recede, the temples move back, you lose density or coverage in the crown, and it can progress to total baldness. There are many other things that can accelerate your hair loss situation.
Like what?
So, poor sleep, poor nutrition, high stress, all of these things, whole body inflammation, all of these things have an impact on the hair follicle.
Oh, wow.
And so if you're like doing night shift, if you're overstressed, maybe even professional athletes who are overtraining can sometimes have difficulty maintaining their hair.
Oxidative stress.
Absolutely.
Right? Creating the inflammation. So now you're really talking about a lot of the stuff that we talk about all the time, the wellness side
This
of
is
it.
your wheelhouse, my friend. Yeah.
Yeah. So which, obviously you've gotten into the longevity space because you know that there's a lot of things that need to be done for your overall health to maintain your health, your hair, right? To not just maintain your health, but maintain your hair. So now with hair loss, there's autoimmune issues and stuff that can also cause it.
Correct.
Right?
So there can be scarring alopecias, autoimmune issues. There can be issues with your scalp health. So people's scalp health is a very common cause of hair loss. If your scalp is itchy, flaky, oily, inflamed, is it tender? It's trying to tell you something. And that inflammation right at the level of the scalp is not going to be so good for hair.
Okay, so this consultation that we're talking about is not going to figure out the root cause.
No.
So take us through the process of like a new patient who's coming into you, male or female, right? How do you put them through the process to kind of really figure out what's going on, right? Because you're talking about DHT levels, so obviously you're doing blood work. You got all kinds of other issues, lifestyle issues. So just guide us through
How
the
do we
process.
do that?
Yeah.
Yeah. So in my practice, what we do first off is take a very, very detailed medical history. So we want to know, first of all, is there hair loss in the family? What kind of hair loss are they experiencing? What's going on with your hair situation? Is it something that happened acutely, quickly, a sudden shed after, COVID infection or vaccination or something like that? Is it something that's happened chronically, progressively? Is it one area or is it a large area or is it the traditional pattern? And then we look deep into the situation. Are you on any medications? Do you have any medical issues?
Right.
Are you on blood pressure medication, mood modulators, statins? Those are all terrible for hair, by the way.
Oh, wow.
Have you had any autoimmune issues? What's your gut health like? And let's talk about that. A lot of our patients come in and they have skin health issues aside from the scalp, or they have gut health issues that are impeding or impairing their nutrition, the absorption, if you will. Even if they're on a great diet, they're not absorbing it properly.
What about like micronutrients deficiencies? Does that have an effect as well?
Absolutely. So, we can look at a lot of different things through the genetic testing that we do to see what metabolic pathways might be influencing your hair and hair loss.
Wow.
That will also pharmacogenetically tell us what medications might be helpful for us, and also what nutrients to look at that genetically you're susceptible to be low, right? So we can, are you prone to low zinc? And I've had patients that they're trying to improve their zinc levels, and like they're trying, and the zinc doesn't budge. Well, in the genetic testing, it tells us, they're prone to low zinc. They're going to need more of a higher dose,
bigger
things like that.
dose,
Yeah.
right.
So I mean, A, C, E, D, all of these B vitamins, all these things are really, really important.
And that's an epigenetic test that you're doing?
So we do, we that's genetic testing. So
Genetic.
that's a genetic test that elucidates those SNPs or polymorphisms in the genome that tells us different metabolic pathways. So are you going to be responsive to minoxidil or not? People say to me all the time, I tried Rogaine, it didn't work.
Yeah.
Well, maybe you're one of the 35% that doesn't have the pathway to activate minoxidil in the scalp.
Yeah.
So 35% of people have low sulfotranferase. You're not going to get a good response from over-the-counter minoxidil. You need something different.
So and guys, listen to this. Listen to Dr. Bauman, what he's saying. Everything he's saying, when he's talking about the metabolic pathways and everything else, this is the science behind it. This is not just come in and get a procedure. We're taking a deep dive here to figure out really what's happening internally, understanding your body. It's more of you're taking a personalized approach with all of your patients.
Oh, absolutely. A personalized precision medicine is like, that's really, really what we do, and a holistic 360 functional approach to the hair loss situation. And it didn't happen overnight. I mean, we didn't just wake up and say, oh yeah, we want to do this. Right. What we learned is that the farther we dug into the patient's situation, into their history, and into these biomarkers or genetic testing, the more things we found that were influencing their hair. And that's how I developed an entire department, for example, for scalp health. Right. I have a certified trichologist and her team. They can do an exam on your scalp, look at moisture levels, sebum level, pH levels, see what the inflammation is, There are signs and symptoms of disruption of microbiome, for example, right on the skin. And we want to rectify all of that before
Okay.
we even consider a hair transplant.
So these okay, so we get the patient who comes in, deep dive into medical history,
Yep.
lifestyle. You're doing all of these different assessments and
Correct.
diagnostics. You got different diagnostic tools to do it. So okay,
AI-powered microscopes to count
wow.
hairs,
Okay.
right? To tell we're going to do photographs, microscopic photographs in at least 3 to 5 different areas of the scalp. We're going to get density readouts, and we're going to get the AI to tell us exactly what the hair caliber is in each zone. The photograph is going to go up to the cloud, come back with all that data. So we'll have density and hair caliber measurements in each area.
Okay.
So that'll be the baseline. We also do cross-sectional trichometry. Think of like measuring your ponytail volume in different areas of the scalp. There's an instrument, a caliper, if you will, an electronic caliper that can help us measure how much hair is physically being produced.
Is that like with women, especially like postpartum, right? They go from having this very full, thick hair, sometimes even very beautiful curly hair, and then all of a sudden they still have a full head of hair, but there's like no volume to it, right? Starts to become thin.
It's very common. And so again, as we said, the hair follicle is also a very hormonal organ, right? And so
Okay.
during pregnancy, there are more hairs in the growing phase. So that's going to make the hair volume increase. It's going to make the hair length increase above normal.
Right.
And so a woman through 9 months of pregnancy is going to have typically a much thicker, fuller, healthier head of hair. It's going to also appear shinier.
Wow.
I have some other ideas on how that's also, skin health also improves typically during that time. Maybe there's some communication also between the fetus and the mom in terms of exosomes that we don't necessarily know about. So maybe there's some cellular communication there passing
Right.
through the placenta. I don't know for sure, but maybe there's some messages for growth as
Yeah.
well as those hormonal changes that's happening within the mother. But anyway, the point is that as soon as the baby's born, what happens to those hormone levels? They shift, they crash essentially back down to normal. And within 6 weeks, her percentages of hair follicles in the growing phase versus the resting phase go back to normal. And so what happens? You see a massive telogen effluvium, which is basically a technical term for a massive shed, acute shed.
Yeah.
And so that happens 6 to 12 weeks out. And sometimes that reveals an underlying tendency towards female pattern hair loss, which can look very different than male pattern hair loss, obviously, not necessarily recession.
Well, I
of the
can tell you,
hairline.
they're not going to be happy at it.
Oh, they're not going to be happy.
Yeah.
If you're, a woman losing her hair, not a happy thing. There's no socially acceptable model, right? Or someone that you can look to for female hair loss, really, out there. Where, men can sometimes shave their head and still look pretty good,
Yeah.
just ask The Rock and so forth. But for women, not
now
too
there
many.
was Will Smith's wife, Jada, right? She had a whole alopecia hair loss thing going on, right?
Yeah, so that's a kind of interesting story because if you look at the photos closely, it looks like her hair is just buzz cut. Like it's not an alopecia areata condition where alopecia areata would knock out all the hair. It would be smooth like a baby's
shiny
bottom.
too,
It would be
right?
shiny,
Yeah.
and the skin would be thinner in those areas where alopecia areata occurred. On one of the photos, you can see what I would consider a line in the top of her scalp that she points to in one of her Instagram videos that she says, "Oh, this little spot of alopecia or something." To me, it looks like a scar. Yeah, I don't know if she had a brow lift in that area or had some kind of an injury in that area, but a little scar would certainly inhibit hair growth.
Right.
And we see that in women who have had facelifts, brow lifts, men and women who have injuries, whether it be a car accident or a fire or some other kind of traumatic injury.
Right.
Some of our military folks that we take care of have had injuries and burns to their scalp. Those are scarring alopecias. So I don't know exactly what went on there. I'm certainly not her doctor. I'm just looking at photos like everybody else online. But it looks like she has a buzz cut.
Yeah.
So, that's not really alopecia. That's like self-induced, right?
Okay.
But maybe that little scar is something that she didn't like. I don't know the answer.
Right. Interesting.
But a lot of times, if you wear hair, right, and we should talk about this, especially women who use hair extensions or wigs or weaves and are using hair additions or wearing a certain hairstyle like braids or things like that, that create a lot of tension on the
That can't
follicle.
be good for the follicle, can it?
Not at all. So that
Okay.
extra tension over time on the follicle, which is under the skin, right, producing hair, will cause the follicle to miniaturize and eventually die and scar. And so if you consistently wear heavy extensions or long dreadlocks or tight braids, you will cause traction alopecia. And that could be
Traction
permanent hair
alopecia.
loss.
Okay.
And it's very, very common.
So that's a good thing to bring up because we work with, especially here in South Florida, a very diverse group of patients, right? We have
Absolutely.
Hispanics, blacks, white, everything. So there has to be a significant difference between the type of patients that you work with, right?
For sure. So we see all types, and many of my patients are international, so they're coming in from Europe, from Asia, from South America. So
So
we
let's
see,
talk about the difference between some of those because I think that a lot of people want to, everyone's dealing with hair loss. So I think that's something that we should talk about.
absolutely. So, for example, our Asian population, their hair is going to be typically coarse, and the cross sectional shape is round, and it's basically straight.
Right.
And so, but they have a lot of bulk to their hair, but their density is low. So oftentimes when they're experiencing hair loss, they don't need to lose a whole lot of density to really look thin.
Okay.
African American patients that have Afro textured hair, they also have low density, but they have a lot of curl.
Right.
And now in cross section, each hair looks kind of like I would just say a kidney bean. It's got kind of a flattened, almost like a ribbon effect to it as it
Okay.
curls around the hair fiber. And of course, they're more prone to those traction alopecia situations because of the mechanisms that they've used
Right.
to try to style their hair since they were, very young, since they
Right.
were children, tight braids to kind of manage that afro texture. And also other things that they do chemically to try to straighten the hair. So perms to help
Oh.
manage it can cause significant damage to the scalp and also to follicles over time.
Okay. What
So-
about those keratin treatments that people do? Does that also?
Yeah, so we talk about chemical processing of the hair, right? There's color and there's straightening, there's Brazilian blowout,
Right.
Japanese ceramic straightening, a whole bunch of different things. This just goes to show how many different things are out there to manage your hair, right?
Right.
But a keratin treatment usually requires some kind of chemical to straighten the hair, and then high heat to form it into that flat and straight
Right.
appearance. And the idea down here in South Florida is that there's less frizz. So, don't tell women you can't have keratin. They can do it, but just maybe they should do something more gentle. And so there's smoothing treatments that are going to be more gentle chemically to the hair fiber. Because think about this for a moment. The follicle's under the skin, and its job is to produce the fiber. The fiber is dead tissue. It's basically like your fingernail, right?
Okay.
If you cut your hair, your follicle doesn't know. You could shave it off every day. You could let it grow for 10 years. Follicles don't care. But as that hair fiber grows longer, it will never ever self-repair. And so if you mistreat it, it's exposed to the elements, to chemicals, to heat, the outer coating of the fiber of the hair can degrade. So that as the cuticle degrades, that's the moisture barrier of the hair fiber, it becomes more prone to breakage.
Okay.
And so that's where you can have some problems. The hair will lose its aesthetic value if the cuticle becomes very damaged. And the easiest way to see this is someone who's bleached their hair for an extended period of time. They have long, blonde, bleached hair.
Right.
The hair looks like straw. It looks like it's been burned in an oven.
Yeah.
It's frayed at the ends. Okay,
Right.
I'm painting the picture of the most extreme kind of damage. But even
Kind of looks like they got electrocuted type of deal.
yeah,
I've
so
seen
that's what it changes the aesthetic value of
Yeah.
the hair. And so what's true across all ethnicities is that hair that is considered valuable is usually shiny and smooth and
Right.
feels soft. And so if you start losing those properties, you've got to go back to the drawing board because you've got to build a new hair from scratch. You have to grow a better hair
Right.
because it's very difficult to repair the cuticle. There are some tricks, the smoothing treatments and things like that.
Now,
but
in your
conditioning.
professional opinion, as a physician,
Yeah.
which is the hardest one to treat with transplant?
Well, there are inflammatory conditions of the scalp, which actually hair transplants are contraindicated if there's active inflammation at the level of the scalp. So one of the things that's happening, we're seeing a lot of today, is a condition called frontal fibrosing alopecia. And this is where you lose the hair. Literally, there's almost no miniaturization. It's just a complete loss of hair. It's turned into like thin, white, smooth skin around the frame of the face. It happens usually in women between the ages of 50 and 65 years old. typically women of middle to upper socioeconomic status who have used moisturizers or sunscreens repeatedly. And there's an inflammatory process that's being triggered, and we don't know exactly why, but typically from these nanoparticles, we believe, that causes this inflammation. It kills the follicle. And there are signs and symptoms. You could do a biopsy for testing for that, but there are plenty of good signs and symptoms that we can see on the microscope to identify this active inflammation.
Okay.
It usually also affects the eyebrows. So if you've lost your eyebrows and you're losing your sideburns and your temples and your hairline seems to be shifting back little by little, you could be suffering from this type of inflammatory alopecia.
Interesting.
It can be very difficult to treat. There's a couple of medications that seem to work. And if we can cool it down, we can test a hair transplant to see in a small area, will it work? And will it survive?
So the focus would be to bring that inflammation down first.
Absolutely. Yeah. And there's a lot of ways to do that. Sometimes topical steroids have been used, PRP has been used, other peptides and things like that. Dealing with whole body inflammation, cooling that down a little bit. Low dose naltrexone is another option, but there's a lot of different therapies and treatments for that particular condition.
So
but
let's
it's very difficult to
talk
treat.
about some of these other treatments, because some people always want to just take the fast track and go straight to hair transplant. But I feel like, you were giving us this whole patient comes in, evaluation, everything else. Do you go straight into transplant, or
Never.
are there certain things that you're doing?
We never go straight into a hair
Right.
transplant. So we're always, even if the patient needs and wants a transplant and they're a great candidate for it, with that, we have to talk to them about protecting the other hair. If you go
Right.
forward with transplantation and you're not on some kind of program to protect the non-transplanted hair, that's a fool's journey.
Yeah.
And actually, you're not a great candidate for me. You might as well go to Turkey.
Yeah.
But
Right.
seriously, if you're not going to,
I'll buy your ticket.
protect your existing hair,
Right.
you're not going to. It's not going to be fun.
Yeah, because eventually you're not going to be happy because you're going to lose your hair again. So, and at the end of the day, you as a physician, you want to make sure you have patients that get the full benefit, right? That are not going to end up losing their hair again, because that doesn't look good for you either. So,
100%. I mean, look, if I was a personal trainer and I was, teaching somebody how to work out or whatever, and then they go and, stop off at Burger King for a fries and shake or whatever on the way
Yeah.
home. I mean, we're going to have a chat about that.
Right,
That's not
exactly.
good. That's not good. That's like
Yeah.
you're detouring our journey here. So, how do we know if patients should be on medications or do things like laser light therapy or have regenerative treatments like PRP or exosome therapy? That's a deep discussion. There are some things that work better for different folks,
Right.
and we can figure that out. But you have to have some plan. Get your scalp health and scalp hygiene on point. Get your nutritional regimen on point. Let's look at those lifestyle factors. Get yourself some sleep. Get well nourished. We've got nutritional supplementation and hair care products under the Bauman brand too. We've got low-level lasers that you can use at home. So these are things you can
Nice.
do non-surgically, non-medically, no prescriptions, and we'll measure it. You come back in, we'll measure and make sure that we're maintaining the existing hair.
So you actually get the data to make sure that you're seeing the progress that's needed.
Every patient, every time they come into the practice, they're going to get measured. We're going to get data. It's a data-driven practice, really.
It is.
Truly.
Wow.
And otherwise, just as a great example, let's say you had this most amazing regenerative treatment, right? A lunch break treatment that you have in the office. There's no surgery involved whatsoever, platelet-rich plasma or exosome therapy, and it works amazing.
Right.
But how do you know when that treatment reaches its peak? And how do you know when it starts to decline? Well, if you didn't take a measurement in the beginning, in the middle, and towards the end of the treatment that we would expect it to last, you're never, ever going to know when you should repeat it.
Right.
Unless all of a sudden you're back to your baselining and now getting worse. Well, we don't want that. We want you to be great and then go from there and maintain or get better.
Yeah.
So that's where the measurements are key component to what we do.
Amazing. So, Doc, what is hair? What is hair?
Oh, hair. Well, we said is a very emotional part of our body, right? It defines us, our youth and vitality. But hair itself is keratinized protein. And so if you're on, let's say, a low protein diet, or you're on a diet drug, or had diets or weight loss surgery, you're not going to grow good hair. You need to have protein to build hair.
Is hair actually alive, or is hair something that's just like dead cells coming out of your body?
Hair is dead tissue. So the hair fiber that you see, that you cut, it's like your fingernail. And what's alive, however,
Because your fingernails are dead cells as well, too.
correct. Like when you trim your fingernail, it doesn't hurt, right? Hopefully,
Right.
if you didn't catch any skin in there. But the nail bed is what creates the fingernail. just like the follicle, which everybody's born with about 150,000 hair follicles on their scalp, plus or minus. And about 85% of them they're very complicated organs. They contain almost 100,000 cells each. There's like 20 different types of cells, and they each have some different property and job to do. The hair follicles cycle on and cycle off over time normally. Think of the hair follicle as like a 3D printer, right? Creating that little strand of hair fiber that we see.
So part of that is like, I always hear people talk about, well, I got to do this treatment. I have to buy this shampoo and all this stuff because I want my hair to be fuller. And there's a part of me, knowing what I know, right, of how you said your hair are dead cells like your fingernails, that buying all of these chemicals to just put on the hair itself, you're just creating a change chemically, right? It's not actually fixing what the problem is. So would you say that you have to focus on what's happening in the inside for you to see the actual effects and results in the hair?
Yeah, absolutely. Now, listen, I don't want to discount what a good haircut can do because, man, a good haircut, good hairstyle, a good cut and color and all that for men and for women can be life-changing
But
as
people
well.
spend so much money on these products, though. It's crazy.
And products, remember, are designed to basically make whatever hair fibers you have either more manageable or look better or more voluminous, but it's a cosmetic appearance. Those products are really not going to dramatically affect the follicle. Now, should you not have toxins in the shampoos? Of course. Should there be some good ingredients that are going to seep in through the follicle? Absolutely. And that's why we put caffeine, green tea, saw palmetto, and other ingredients that are healthy, rosemary, whatever, that's going to help the hair follicle do its business better. But there's no magical miracle shampoo for hair growth. That's not going to happen. So yes, you have to build from the inside. Every hair follicle is connected to blood supply, and that's nutritional support, obviously. There's contributions with the local adipose tissue, with fat cells within the scalp, and the fibroblasts, which are the skin cells, and all of that niche, if you will, where the hair follicle stem cells live, all of those different types of cells contribute to making the follicle do its business as good as it can be. And that's what we want to try to target.
Okay. And how are you stimulating those things?
Well, gosh, there's a lot of ways to do that. So pharmaceutically, you can use products like minoxidil, either orally or topically. You can use low-level laser light therapy, for example. Red light is a great energy producer within the hair follicles, which, by the way, are some of the most highly metabolic cell populations in your entire body. And so if you apply red light in the correct way, which means the correct device, the correct dose, the correct duration, the correct frequency, wavelength, all of that needs to be tied down. A true clinical grade, medical grade device, like a turbo laser cap, for example, is a great example.
I've seen those, like the little helmet looking things. Caps.
So yeah, I would gear you away from the helmets and the caps and more towards the more flexible, powerful versions. Okay. Not like the Amazon one that you're probably talking about or
like
Instagram.
$19.
Yeah. So let's talk about that. There's, in the world of laser light devices, there are devices that are thousands of dollars long, and then there are other devices that are hundreds of dollars. And obviously, if you were going to go out and buy a TV, you would certainly know the difference between the two. Yeah. In terms of that price point. More diodes, it's going to be a higher price point. More pixels on the TV, it's going to be a higher price point. Right. So you want to look for one that's a clinical grade or medical grade device, and that's the Bauman Turbo Laser Cap. That's an award-winning device.
Nice, I love that. So what about nutrition?
So nutrition is important. If you are on a special kind of diet that's deficient in protein, you are not going to grow hair. If you are on some kind of weight loss medication like Ozempic, all the rage right now, people are losing massive amounts of weight on Ozempic.
Oh, wow.
They're also losing massive amounts of hair.
They're losing the hair from Ozempic. Yeah.
Well, what happens?
I didn't hear that. Wow.
No, it's a big, big problem. We have, hundreds and hundreds of patients over the past year or two that have come in who are on weight loss medications who are having trouble maintaining their hair. They're noticing
why is that? What do you know what the mechanism is for the medication?
Absolutely. I mean, we can guess at it. We know that Ozempic slows down the gut motility. It decreases your appetite. So your caloric intake is going to be less. So your body starts to triage whatever nutrients and fuel it has differently. Okay. And we've seen this before. This is not new. We've seen it with fad dieting. We've seen it with bariatric surgery. So weight loss surgery, for example, like something to shrink your stomach or staple the stomach or put some kind of a balloon in there, whatever, is going to decrease your appetite and decrease your caloric intake, right? Right. And so when that happens, you're going to lose, 50 pounds in 6 months, something like that. But you're also going to lose a boatload of hair.
Yeah,
because there's not enough nutritional
right, the nutrients
support.
deficiency and all kinds of stuff. And a lot of those bariatric patients, that there's all kinds of different supplements and stuff for them. Yeah, because that's important. If you're not actually supplementing it, you're just never going to get the nutrition because you're not eating. That
Correct.
makes
So
sense.
you're losing those critical micronutrients, but probably more importantly, you're just on a caloric deficit,
Right.
and that's a big problem. And so there are ways to help maintain your hair if you're on a weight loss program. You just have to supplement maybe with a collagen peptide protein powder, making sure your nutrient intake is good. It's all about nutrients and fuel.
Right.
Because when you're on a weight loss regimen, whatever the weight loss regimen is, your body's triaging the available nutrients totally differently.
Right.
Maybe you're burning fat. Well, that's fine and good, but your body's shunting that energy towards vital organs and not your hair,
Yeah.
by the way.
Yeah.
So that can be a big problem.
So okay. So we got some treatments. We got supplementation, making sure our nutrition, our lifestyle is on point. Now it's time for the hair transplant. What do we got?
So hair transplant surgery today is not a quick process. It does take a number of hours to accomplish moving these thousands of follicles around. Some patients might need more than 1 day of a procedure, but it's going to be a comfortable process. We're really keen on keeping you 100% pain-free, comfortable, relaxed in the chair at the time that you're in the office. So you come in, we make a plan of action. We're going to do some photography, track your current state of hair loss. We're going to design, if it's a hairline, we're going to design that. If it's the crown area, we map it, and then we're off and running.
So and there's different technologies when it comes to hair transplant, and you've been part of it since the beginning. You were one of the first, or the first, with NeoGraft, right?
Yes, I was the first board-certified hair transplant surgeon to own and operate a NeoGraft tool.
Wow.
And that was really a game changer. Most people today don't even remember NeoGraft. It was back in the mid-2000s when we got that device. And that was really, truly the first mechanical device that we could use to perform FUE efficiently and effectively, to carefully get those follicles out of the body. And listen, I developed the first manual tool that was commercially available for FUE. And so, but I'm not disappointed that didn't take off. That was called the Bauman Mindex, and you can read about it. It was a small device, and nobody's retiring on that device. So it is what it is. But NeoGraft was really, truly groundbreaking at that time. And we were super excited because it was we felt like we split the atom when we got the NeoGraft.
Wow.
It really, really worked well. And that's, as you say, it was on every major morning news show. We did live surgery on the internet from, broadcast out of the, today it's the whole big deal. You can go live on Instagram. But at that time, live surgery was never had been done before. Wow. We did live surgery with hair transplants in 2010, and that made news around the world. We had over 100,000 viewers watching that hair transplant. More people were watching my hair transplant than people were watching CNN that day.
That's amazing.
And that was when CNN was popular.
Yeah, wow, that's amazing. So fast forward to today.
Mm-hmm.
What are the technologies that make the hair?
What am I
transplant?
excited about?
Yeah, what are you excited about?
Yeah.
What is it that's working?
So, of course, we've had a lot of tools since NeoGraft. Many mechanical tools, robotic tools, even in the practice. But those all had some limitations. Today, the tools allow us to do this amazing transplant, which we call VIP FUE, and it's a no-shave hair transplant harvest. So you can actually now harvest the hair follicles from the back and sides of the scalp without trimming any hair whatsoever.
And what technology is that?
So it's a motorized mechanical manual tool.
Okay.
But it doesn't cut the hair as it takes the graft.
Okay.
So it's a combination of the tool itself, which, just for lack of a better way to explain it, basically, finely tunes the rotation of the instrument.
Okay.
And does not cut the hair.
And how many doctors have this tool?
Oh gosh,
Is it a lot, or?
No, this is a very, very specialized technique, and there are not many physicians around the world that even do no-shave hair transplants.
Oh, wow.
There's only a handful of us.
Really?
Yeah, probably 6 or 8 of us around the world.
Are you the creator of this?
I am not the inventor, but we certainly do a lot of it at the practice.
Right.
It's a fun procedure to do. Now it does take a little bit longer to perform.
Right.
There's an additional cost to that, obviously, because it does take more time. And there's also a limit as to how many hairs we can actually transplant in one of those types of procedures as compared to, let's just call it a wider shave where we get more access.
Yeah.
So, but for women who don't want to change their hairstyle, guys with longer hair, they don't want to shave their head, which is obviously pretty typical when you're going medical tourism. They
Right.
shave everything.
They shave everything.
You know, we don't have to shave anything. Not the recipient area, not the donor area, nothing.
That's amazing. So, you know, when we talk about hair transplant and hair restoration, we're always focused on like the top of our head,
Mm-hmm.
right? But you've done things like eyebrows, eyelashes, you know, beard. So how do these work? And are they the same donor sites that you're using to do something like a beard or eyelash, or how does that work?
Well, sometimes for beard, let's just say, you know, you're trying to fill in the areas of the goatee, you want a little stronger there. We can take the beard follicles from under the neck.
Okay.
You know, there are other cases of beard where we're trying to enhance, you know, the jowl line, let's say, and we've got to access this hair from the scalp,
Okay.
you know, to get those kinds of numbers. So it really depends. When it comes to eyebrows and eyelashes, yes, we're using the scalp hair and we're using that no shave technique because we want to see the curl of the hair. That's really important for the artistry of the brow and also for the implantation technique of the eyelash.
What are all the donor sites that you actually utilize for any kind of hair transplant?
Oh man, if you've got hair there, we've been there, you know,
Really?
to be honest. Yeah.
You know,
so-
and I'm going to just say it, but you know, like I've heard people talk about like when they do the beard that they'll actually use pubes for that. Is that true?
So there are physicians that do that. Yeah.
Okay.
You know, Howard Stern asked me when I was on his show if I could take the hair off his testicles and put it on his head. You know, but so we have done pubic to scalp transplants
Really?
in the past. Yes. So that is part of what we've done at Bauman Medical. I wouldn't say it's a common procedure.
What's the most awkward place you've transplanted hair
Into or from?
into? Or let both.
Yeah. So below the belt is probably the most awkward place. You know, we've had women who have done, let's say, laser hair removal and then decided that they want some hair back in that area.
Okay.
So, you know, we have transplanted hair to that area. And as I mentioned, I've had a patient where we harvested not only chest hair, but arm hair, body hair, underarm hair, and pubic hair to put on his scalp
Wow.
and beard.
That's amazing.
Yeah,
So there's
so-
so many options for people that are
Yeah.
losing
But again,
their
those are
hair.
pretty rare. You know,
Yeah.
those are some rare
And,
situations.
you know, even like the eyebrows, though, it's like you see a lot of women go and get these tattoos done and everything else because their eyebrows are very thin or they're losing them. There's an option for them that doesn't require getting your face tattooed.
Right, and the tattoo, honestly, the micropigmentation is very flat looking, in my opinion. It's very two dimensional. Even if
Right.
you have microblading done, it still doesn't look like a real eyebrow. So adding to that with hair transplants from the scalp is a really nice way to kind of rebuild the eyebrows. And you know, we've been through a lot of different phases here over the years. You know, we went through like the 1980s where it was like this wafy, thin brow, and now
Right.
I think hopefully maybe we're getting out of the Kardashian era where it was much thicker. But you know, certainly the eyebrow styles have changed. And so if you overplucked in the 80s, you know, and now you want the Kardashian one, you're going to have to transplant it
Right.
to make it happen, you know.
Exactly.
But maybe, you know, you've tried to style your brows, or maybe even just with age, they've gotten weaker. Look, eyebrow transplantation for men is increasing in popularity.
Oh, really?
Men are realizing that a strong frame of the face includes robust eyebrows.
Wow.
And if you just have like a little tuft of eyebrow, you know, in the middle and you don't have the tail, really it starts to look weird. And so, you know, adding that back in is super simple and easy. It's a
Right.
one-day bit of business. Yeah.
I like that. So, Doc, you
Yeah.
speak publicly. You teach a lot of doctors all around the world, internationally. For the doctors that are listening, that are considering to get into the hair restoration business, what's your advice? Where do they start?
Well, first of all, it's an amazing field, but it's not simple and it's not easy. And I think that's one of the things that, you know, sometimes in the world of hair transplant and hair restoration, you know, the information that we get online is that, oh, it's just a simple and easy thing, and here you go, sign up and go. But to perform a hair transplant, first of all, is a labor of love. I mean,
Right.
it's a 20 man-hour job between the hours of 7 a.m. and 5 p.m.
Wow.
to get the job completed. So you need a robust team. You need to have a good plan. And that's just the procedure itself. That has nothing to do with the evaluation that we talked about. We
Right.
spent a lot of time talking about how to evaluate and what the algorithm is and so forth. So I would say that if you think that you have some dexterity, you should first come and observe a hair transplant. And my office is open to observers. We have an open door policy. You can come in anytime and observe what we do and how we do it. We also have more robust training programs.
Nice.
So through the Bauman Institute, which includes programs for non-medical folks as well as licensed medical practitioners.
Okay.
We have a hair coach program, which where you can come in and learn about hair loss and see how regenerative treatments like PRP, PDO, another technology, or even TED, transepidermal delivery, how these treatments are done, how the evaluations are done, how do we use the microscopes to see what's going on. You can come in and do a short-term fellowship, meaning a preceptorship where you're just observing for maybe a day or two at a time, or maybe you want to come in for a week or a month or longer. So we have all of those programs through the Bauman Institute. But I would say connect with us through the website at baumanmedical.com and send us a note if you're
Amazing.
interested. I would say go and observe hair transplants. Come to the meetings, the International Society of Hair Restoration Surgery, and there are many other meetings as well. But that's really the main one where people gather. Last year was in Denver. Next year is in Berlin.
Oh,
So
nice.
come to the conferences and learn the right way to do things. And look into things like board certification and look up what it takes to become a board certified hair restoration physician. Because what you're going to find out as you start to dig into it is that there's a lot of mistakes. And I'm here to help you avoid those errors as you go
Right.
through. Let's help some people. But if you're passionate about hair restoration, look me up.
Yeah.
You can find me on all social channels. Just drop me a message,
And guys,
and
listen,
connect with me.
You guys always hear me say it's like every great athlete has a coach, and Dr. Bauman can be the coach to get you through that process so you can offer some of these procedures to your
Yeah.
patients.
At whatever stage you're at in learning about hair restoration, I don't care if you're a medical student and you want to come in, or you're in your undergrad, you
Right.
can come in and observe with us. We have high school students, undergraduates, we have medical students, we have interns, residents, and people who have been doing hair transplants for a long time. They want to sharpen up their skills, look at an eyelash transplant, or learn how to do FUE faster, better, whatever.
There's
That's
a
what we
solution
do.
there for all of us to learn.
Absolutely.
So I love that. And Doc, before we wrap up here, for that one person who's struggling with their hair, right? What is that one message that you can leave them with?
Yeah, probably the most important thing, Sam, is if someone's out there with thinning hair and they've got some hair loss, they know maybe they're at risk for hair loss, they're seeing some hairline recession or some other sign or symptom, they're seeing their ponytail volume decrease. First of all, we want to say time equals follicles, and that means that the longer you wait, the worse the hair loss is going to be. So
Oh,
take
wow.
some action. We're available. You can visit baumanmedical.com for information. There's over thousands of pages of information, hundreds and hundreds of hours of video. And if you have just a simple question, you go to baumanmedical.com/ask, and you can type in a quick question. And I promise my team and I will get back to you with the answer. If we know it, if we don't know it, we'll find out. But if you want to start a hair restoration journey, you need treatment, or maybe you've been doing a Rogaine over the counter, or you got something from some cloud pharmacy, online pharmacy, but never talked to a doctor about your situation. That's where you need an evaluation.
Right.
So we can start that either in the office. Certainly it's great. We've got all the technology there, or we can talk about it online. Send in a couple of photos. We can set up a Zoom call, figure out what's going on, take the first step. But there's a lot of hope out there. We can fix it. We can address it. We can keep the hair that you have and restore the hair you lost.
Amazing. And we're going to put all these links right down below. People are going to be able to follow, check it out. So, Doc, I appreciate you coming on the podcast, sharing all of this very helpful information for both the doctors and the consumers. You're doing some amazing stuff. You're making people feel well, getting their self-esteem back. I appreciate it.
Thanks, Sam. It's really a pleasure to be here with you. Thanks for having
Awesome.
me.
Guys, thank you for listening to another episode of A Healthy Point of View podcast. Make sure you click, subscribe, follow, do all that fun stuff. Leave comments. Share this with all your friends. Until the next one, we'll see you.